Let's come back to the rising COVID numbers, especially here in Gauteng, which is battling the most intense COVID-19 outbreak in the country. The province is currently considered the epicenter of the third wave, with more than 60% of daily cases from this province of Gauteng alone. The Premier hinting at imposing stricter regulations to fight the spread of the virus. Could this be the solution? Let's speak now to health expert Dr. Kgosi Letlape, who joins me via the virtual platform. Doc, thank you very much for making time for us. I want to start off with the inoculation drive targeted at teachers. There's a strong view from at least one health expert who says schools must shut down, and once the teachers are inoculated, at least give the time span of about 4 weeks for the vaccine to actually take hold and, I guess, sit still in the body. Would you agree with his suggestion?
I think that's one thought. What we need to know is what is really happening in the schools. As you see in the nation, we record the numbers of infections and we take appropriate action. What should happen is that all the measures, the COVID measures, should be undertaken at the schools. If there are people that are symptomatic, they stay away from school. Those that need testing, they get tested. And you see what is the positivity rate in a school. If you see the numbers rising in a school, you then take action. We need to be nimble now and localize maximum effect depending on what is happening. Let us respond to the virus, not to textbooks.
Is it a responsible thing to do, Doc? I'm sorry to interrupt you. Is it a responsible announcement then from NG Motshekga to say we're not shutting down schools, particularly in provinces that are hard hit like Gauteng?
Well, you know, there's a command council that is dealing with the issues of coronavirus, either at national or provincial level. And I think that's where the decision making in terms of coronavirus are being made. What we should be asking is, what is the command council saying at national level? What is the command council saying at provincial level? Is the Minister of Education breaking ranks with what is being said by those tasked with the responsibility of making these decisions? It should not be about my opinion or a scientist's opinion. It should be there's a collective that's supposed to make timeless decisions. What is the collective saying at this point in time?
All right.
If the Premier of Gauteng closes schools, that's what's going to happen. If the provincial council says so.
All right. Let's talk.
From the department, they say, let's close schools. From national, that's what should happen.
Let's talk solutions then, Doc. In Gauteng, strong indications are that we are going to see tighter restrictions, or to put it in the language of government, we might possibly increase the lockdown regulations. There has been talk of level 4 or possibly even going to level 5. Could that be the solution to stem the tide for now?
I think people need to understand the simple fact that at this point in time, the only thing we have to fight this virus is the non-pharmaceutical methods. Vaccinations help those that get vaccinated in terms of the severity of disease that they would get. But the numbers are so small at 3% that it makes no difference in terms of community spread. Curbing the spread of the virus is going to be on non-pharmaceutical methods, which means we must wear our masks all the time, covering our mouth and nose, hand washing, sanitizing where possible, physical distancing. But the biggest behavior that will make a difference is we at the personal level avoiding gatherings at all costs.
Evidently though, Doctor.
Family, social.
Evidently though, Doctor, I'm saying the evidence on the ground does suggest, therefore, that there is somewhat of a reckless behavior. In fact, I'm probably putting it mildly, because authorities, for them to want to push the lockdown restrictions even higher, is because of that personal behavioral pattern that is not sinking in? Or probably it is sinking in, it's just that people are tired of wearing these masks, I suppose.
Well, I don't think people are non-compliant. We got to get out of our lexicon this issue of fatigue and tiredness. We're fighting for our lives here, and no one can be fatigued whilst they become vectors spreading the infection. Clearly, the measures that we have in provinces that have a surge are not working. So we got to increase those defensive measures.
Yeah.
There's absolutely no question in my mind. We could have gone harder earlier, but we need to go hard now in terms of restrictions.